Hey, what's going on, everyone? So, hope you guys are doing well. And sorry for the reason I didn't upload a video for a while because I was not well from the past few weeks, but I'm fine now. So, let's talk about something more important today. So, guys, if you think I'm gonna talk something about tech, then sorry, guys, this video is not for you. After seeing the COVID crisis, I thought why not should I make a video about it. So today hospitals across the country are facing a lack of hospital beds, oxygens and ventilation. So you have to prepare for the worst scenario that if someone in your family or your friends get COVID-19, the chances are that they will not get a hospital bed. In such case, you will have to keep them at home and treat them. So in this video, I will try to explain the home treatment of COVID-19 step by step. In the worst case scenario, if you cannot get a hospital bed or a doctor to consult. So for this video, I specially get consult from my family doctor and research on the internet, some blogs and some YouTube videos too. From that, I get some guidelines step by step about what can be done to treat COVID-19 at home. Now I know that other channels have talked about it already, but I don't really care if they have talked about it, right? If there is some positive and much needed, important, informative video, then why can't multiple people talk about it? So firstly, there is a WhatsApp forward that is very viral nowadays. It's tell you that inhaling camphor, ajwain and long will help in boosting your oxygen level and it will help in treating COVID-19. This is completely fake news, guys. It will not help you in any way. So please don't try any information given in the WhatsApp forwards. It can instead harm your health. I'm sorry guys if my voice is not that clear. It's 4 a.m. in the morning and I'm making this video for you. Now let's see the scientifically proven techniques that actually help in treating COVID-19. If there is a victim of COVID-19 in your home, first isolate them. After isolating them, it's important to monitor them as well. You would need a monitoring equipment here. Is a pulse oximeter. This is a small device that goes on the finger. It's cost around a few thousand rupees and it's measure the oxygen saturation level. Apart from this, a thermometer to measure the temperature. Gloves for the person who will care for the COVID-19 victim and mask for everyone to wear. Garbage disposal bags, hand sanitizers, the room where the COVID-19 patients would stay. Keep the fans on and the windows open because ventilation is very important. All this is done so that the infection is not spread among others. The thermometer and pulse oximeter will be the two main monitoring devices that will help in monitoring the COVID-19 patient. Whenever you use them, do not forget to wipe them with a cloth so that the reading is always accurate. Create a simple table to record the data on your computer. You can make it in Excel or you can ever draw on a paper. You have to measure three things every 6 hours: oxygen saturation, pulse and the temperature from the thermometer. First, measure the oxygen saturation while sitting and after that you have to exercise for 1 minute and then measure it. If the oxygen saturation in the patient is more than 94%, then there is nothing to worry about. It is a normal and there is no need for hospitalization. But if the oxygen saturation is between 92 to 94% about something, then start measuring it in every 4 hours. And if it fails below 92%, I will tell you what to do in the next step. And on the other hand, you have to measure the temperature every 6 hours as well. If there is a fever, you have to give paracetamol. 1 gram of paracetamol every 6 to 8 hours. Depends upon the fever. In this situation, the hydrogen of the patient is very important. So ensure that the patient is drinking a sufficient amount of water, and to help this patient, inhale steroids like budesonide can also be given twice daily at the dose of 800 mg. This steroid often comes in a aerosol packaging and a spacer is needed to inhale them. A spacer is look like this. It is used for asthma as well. Let's come to the next scenario. If the oxygen situation fails between 92%, in this case, if a hospital bed is available, the patient should be admitted to the hospital. The medicines and the steroids that the patient should get in the case are this: dexamethasone 6 mg a day or any equivalent steroids. Prednisone 40 milligrams or hydrocortisone 150 milligrams. Anyone can this administrated and it does not matter how the steroid is prepared. At the night when the patients go to sleep, ask them to sleep in a prone position, which means sleeping on their stomach. Like this is a very simple and scientifically proven technique of increasing oxygen saturation. Apart from this, in this scenario, again use a paracetamol for a fever, maintain a sufficient hydration from drinking a lot of water, and make a passive leg movement for the patient, which means take the leg and move them and keep them in a different position like this, so that their blood circulations remain good, so that the blood circulation is not affected because of lying in the bed for a long period. And in this scenario, you will also need a supplement oxygen at home, so please try to arrange the oxygen from somewhere. You can also use a nasal canal. This is the tube-like device that goes into the nose. It helps the oxygen to flow from the oxygen cylinder to the body of the patient. Maintain the flow rate of 2 to 4 liters per minute. Starts at the lower rate and scales up to 6 liters per minute if it's required, as long as the oxygen saturation of the patients remains above 92%. And obviously, when the oxygen saturation in the patient would increase, then they would not feel breathless and their respiration rate, that is the number of times that the breathing per minute, would go below 24 per minute. Then you can say that the patient has started to improve, which is a good sign. But if this does not happen, the oxygen saturation falls below 90%. In this case, if you can get a hospital bed, it will be good, because it's very important to move into the hospital bed. But if there is no hospital beds are available, then you have to continue the same treatment as home. Keep giving the drugs in the same quantities that I mentioned before. The oxygen flow rate can be scaled up in the case from 6 liters per minute to 10 liters per minute. If the oxygen saturation remains below 90%, then keep administrating the steroids and maintain a prone position during the whole time. The improvement in the patient will come only when the oxygen saturation goes above 92%, and the respiration rate will be less than 24 breaths per minute. This is the sum list of the steroids that should not be used, people considering them useful at some times. But the research paper published later had started, they said they are not useful. All the hypes for these drugs. But in reality, this drugs is almost useless. But the other steroids that I showed you about, they are actually helping in the treatment. The steps of the home treatment that I told you about, it is advisable, if it's possible for you, to get an initial assessment done for the patient at the very least, the hospital or a clinic by a doctor, so that the doctor gets to know about the pre-existing condition of the patient and the precautions that would be required. Because what happens at the time when something is recommended, like this position of lying on the stomach, some steroids, if someone is pregnant, obviously they should not do that, right? If someone has a spine problem, they shouldn't do that too. So like every patient is different. There are some slightly changes in the treatment based on the exiting problems, and which can be recommended by a doctor only. This is why it's advisable to get an initial assessment from the doctor. If that is not possible, then take a oversight of a doctor or a nurse through a phone call or a video call. It will also be a good. Apart from this all, keep practicing sanitizing, physical distance, and wear a mask, especially if there is a COVID-19 patients in your home. Wear a mask when you're traveling outside, and please maintain a public distance. Promote the vaccination. And one thing I will like to tell you is vaccination is a prevention. It is not a cure. Okay, the vaccine is not a medicine that if you get a COVID-19 it will cure you for sure. No, this is not the procedures of the treatment. If you have a symptoms of COVID-19, you should not take the vaccine. Wait till the symptoms go away and take the vaccine after that. It's just a precaution. So if you don't want to get the vaccine, avoid it. It's depend on you. Because by taking a vaccine, you can basically train your immunity system. Otherwise, as like I say before, if you don't want to take the vaccine, you should eat some healthy foods which increase your immunity power, like exercising to maintain your health condition. The blood circulation level will increase. Be hygienic, and please eat some healthy foods which can improve your immunity power, overall your health. We train our immunity system for fighting against the disease, right? But if your immunity system is already under stress because you're already suffering from the disease, then what will the training do when you are already affected, right? The exercise and the training will be useless and it won't help you. And another thing is that because it takes some time for the training, so be extra conscious after taking the vaccine. Practice extra social distance, hand washing and sanitizing. Obviously you have to do that, and because immediately after taking the vaccine, if you get the disease, it will be very difficult for your body to उसको body आपका संभाल नहीं पाएगा उसे. So you have to train the immunity system as before, and the actual disease comes as well, and that is added stress on your immunity system. That's it for this video, everyone. I hope this video will be helpful for you, and please share this to your family members, friends and relatives so that we can have the precaution. So be safe, and let's have a hope this COVID will definitely come to an end. And if you like this video, please hit the like button and subscribe to my channel. That will really helpful for me.